Hi, I'm Pam Henry with MyCareConnect, and I'd like to thank you all for participating in our Back to School Checklist webinar tonight. The other people here with me are Crystal Jackson with the ADA, Kathy Patrick with the Colorado Department of Education, and Sarah Butler with the NASN. We hope that what you'll take away from tonight's webinar is a checklist and tools to help you help children as they transition from summer into the fall school year, and that everyone is able to make sure that the needs of the child while they're at school are being met. For the first 30 minutes, we'll provide you those tools and suggestions as we go through our presentation, and then for the last 15 minutes, we'll go through the questions that so many of you submitted before this webinar. Because there were so many questions that were submitted, we weren't able to get to all of them, but any that are not answered, we will provide those answers and post them on our website at mycareconnect.com/webinar, and we'll also provide a copy of or a recording of this webinar at that web address as well. So first off, I want to get everyone into the frame of mind of what we're talking about. I want you to remember that diabetes is a 24/7 disease. There's no break for it for families, and especially for the child with diabetes. It's very important that that transition from home to school is a good one, not only as we go from summer to fall, but on a daily basis. That needs to be a smooth transition. Students need access to whatever they need to help manage their diabetes. And for parents, you need to remember that written care plans are required as you start out the school year, especially doctor's orders. And so you need to check with your doctor and with your school nurse about the timing of those papers. There are daily challenges for all caregivers of kids with diabetes. For parents, I can tell you about my own challenges. In preparing this tonight, my husband asked me to write a list of challenges that I face as a mom of a child with diabetes. And about 15 minutes later, I gave him 6 pages full of challenges. So he told me he didn't need quite that many, and I told him that I gave him what he asked for. But just to name a few of them, it's balancing family life. You know, most of us do have other children, and just because we have a child with diabetes doesn't mean that those other children don't need just as much attention. There's wanting peace of mind that I know that when Sarah's not with me, that she's being well taken care of, and that others are looking out for her. Then there's the independence. As she's becoming a teenager and is pulling more away from her father and me, we need to give her that independence, but it's hard to know just how much to give her with us still wanting to monitor her and make sure that she's doing a good job. Then there are challenges for the child themselves, not wanting to be different from their other classmates, having to deal with nagging parents, not that I would ever do that, and feeling judged based on their blood sugars. So many times parents don't mean to react when their child tests their blood sugar and it's high or it's low or it's not what we wanted it to be. But we need to remember that a blood sugar is just a number, and it's just information that gives us what we need to know to make an adjustment. So it's very important that we not react, good or bad, or judge our children based on what their blood sugars are. And the challenges for the nurse, communicating with parents and with doctor's offices can be difficult, especially as there are a lot of different parents who like to be communicated with in different ways, whether it's email or text messages or phone calls. There's keeping up with the technology with diabetes. There are insulin pumps, and they change quite often. There are CGMs. And then there's the fact that they have other kids in their school who might have other conditions that need their attention as well, like asthma and allergies, and even a child who needs to take medication daily is someone else that they need to take care of besides their child with diabetes. And then finally, there's the clinicians and the CDEs. One of their biggest challenges at this time of the year is preparing doctor's orders and getting those to the school in time for the school year. And communicating, again, both with the school nurse and with parents can be a challenge for them. And finally, teaching children self-management. And just like the parents need to figure out that balance of when a child is ready to take on more responsibility, the doctor's office needs to do that as well and know just how much responsibility to put on their different patients. Okay, I'm going to turn it over to Crystal now, as she's going to talk about legal protections for our children.
Good evening, everyone. I'm Crystal Jackson. I am the director of Safe at School at the American Diabetes Association, and I'm very pleased to be here tonight. I'm going to talk briefly about legal protections for students with diabetes. Parents, diabetes healthcare professionals, school administrators, and school nurses should be aware of the students' rights and the school's legal obligations under federal and state laws. Federal laws include Section 504, the Rehabilitation Act of 1973, the Americans with Disabilities Act, the Individuals with Disabilities Education Act. These are all laws under which students with diabetes are afforded protections. State laws also provide protections and also impact the delivery of diabetes care to students with diabetes. State laws might include state education codes, school medication administration statutes and regulations, Good Samaritan laws, and state nurse practice acts. Regardless of state laws and regulations, the requirements of federal laws must always be met. And because diabetes is a disability under federal law, all kids with diabetes who attend a school that receives federal funds are covered by Section 504. This means that schools must meet their diabetes needs. For the younger child, this might mean that there needs to be someone at school, a school nurse or other trained school staff member during the school day, before and after school for school-sponsored activities, and to provide care on field trips. This person, whether it be the school nurse or another trained school staff member, should be prepared to meet the needs of the child, including the administration of insulin and glucagon. For the older child, this might mean that the football coach or the athletic trainer knows how to recognize a low and give glucagon. Kids in daycare, camp, and other private school settings may have protections under the Americans with Disabilities Act. Kids whose diabetes or another disability adversely impacts learning may have rights to services under IDEA. Also, 27 states have passed specific school diabetes care legislation or achieved regulatory reform. Other laws and regulations should be taken into account when planning for diabetes care at school. Parents should contact their child's principal or 504 coordinator to initiate the 504 IEP process. And this is to ensure that their child's needs are appropriately met at school. A Section 504 plan or an IEP that is consistent with the child's physician's orders or the child's diabetes medical management plan should be developed by the 504 or IEP team. And usually among this team, it does include the school nurse. Next slide, please. Okay. One question I frequently get is how are the laws enforced at school, what vehicle or mechanism is used, and what are the written care plans and orders that are predominantly used at school. And first I want to talk about the Diabetes Medical Management Plan, or the DMMP. A simplified way to think of the DMMP is to think of it as doctor's orders. It specifies what needs to be done at school to manage a particular student's diabetes. The DMMP is written by the healthcare team with input from the student and parent guardian. It's signed by the child's healthcare provider. The 504 plan is a broader accommodations plan that's developed for kids who are eligible for services under Section 504 of the Rehabilitation Act. There is a sample 504 plan on the American Diabetes Association's website at diabetes.org/504 plan. A 504 accommodations plan documents reasonable accommodations needed to support the academic progress and ensure equal opportunity. It's written by the 504 team, which normally includes, well, it can include the student. It does include the school nurse, teachers, administrators, and the parents. And for kids who qualify for services under IDEA, an individualized education program or an IEP is required for those students to receive special education and related services under this law. The 504 plan in the IEP should be consistent with the physician's orders or the diabetes medical management plan. The diabetes medical management plan and the physician's orders serves as the basis for the Section 504 in the IEP. The IHP, or the individualized health care plan, is a document that's usually developed by the school nurse that translates the diabetes medical management plan into a plan that works in the context of a particular school building or program. That is, it identifies the by whom, when, where, and how diabetes care tasks prescribed by the healthcare team will be carried out. The school nurse writes the IHP, but it's developed with input from the school health team. The IHP is not the same, nor is it a substitute for the 504 plan. And then last, we have our emergency care plans, which is a resource or tool usually developed by the school nurse that provides easy access to information to support school professionals in identifying and responding appropriately to high and low blood glucose levels. Next slide, please. Okay, communication is the key. Have reasonable expectations, both as a parent, school nurse, student, school administrator. Have reasonable expectations and be aware of others' expectations and concerns. For parents, think about what your child truly needs. For school nurses, understand that the parents do know their child best and are most familiar with their daily diabetes care regimen. Communicate your needs or your child's needs, then stop and listen to what others have to say. Along with parents, school nurses and diabetes educators are advocates for the student's needs and are usually part of, the school nurse is usually part of the 504 and the IEP team. We advise that you write everything down, that the plans are a great communication tool, so write everything down in the student's 504 plan, IEP, and other written care plans. In fact, it's important to put everything in writing so that everyone knows how your child's needs will be met and everybody knows their respective responsibilities. Next slide. Okay, parent roles and responsibilities. Every team player has roles. The parents' roles are to provide supplies, blood glucose monitors, lancets, pouch strips, logging tools, supplies to treat hypoglycemia such as glucagon, insulin injection or pump supplies. Make sure to provide the medical orders or the DNMP in a timely fashion to the school nurse and review it with the school nurse. It's important to review your child's specific symptoms of hyper and hypoglycemia with the school nurse and others who have custodial responsibility for your child. Share specific management strategies with your school nurse. When is your child most likely to go low? Where does your child prefer to get his injections? Ensure that school personnel have updated contact information. Also, it's important to inform the school and the school nurse about changes to your child's health or medical orders. Work with your school to make sure all written plans, including the DMMP 504 or the IEP, are current and properly implemented. Be knowledgeable about federal and state laws that apply to your child or to the student with diabetes, and work with the school team to develop a 504 plan or IEP for your child.
Hi, my name is Kathy Patrick, and I'm the State School Nurse Consultant in Colorado at the Colorado Department of Education. And talk a little bit about the role of the school nurse. You need to look at the school nurse as a partner and an advocate, and in most cases, they're the only health professional in the building that can truly understand what needs to be done for a child to safely attend school. Nurse's scope of practice is defined by their Nurse Practice Act. Remember that they're most likely not being difficult when they're unable to comply with requests, that they need to follow what's required of them under the law. Healthcare provider orders are needed by the nurse to be able to provide the necessary diabetes tasks. Now, every school has a different Nurse Practice Act, so it's important to be familiar with it, especially as it relates to delegation. Most states do have a state school nurse consultant, either at the Department of Education or at the state health department, so utilize them. They are a good resource, and they can let you know what's available in your state. The school nurse will be the care coordinator for the child in the school, so they're the ones that are going to be doing the assessment of the child's needs and using that information from the medical orders to develop the plan. Of course, this is done with the parents' input. And the school nurse will be doing the training and supervising staff involved in the child's care. The school nurse is a valuable part of the team, as mentioned before, in any special education or 504 evaluation, so make sure that they are present. And they will help determine what are the related services and accommodations that the child needs. Look at pre-planning for non-routine events like field trips, classroom parties, and extracurricular activities. A child with diabetes should be able to fully participate with their peers. Also plan for school emergencies. More and more schools are having possibility of lockdowns, and so you need to know how the school will be providing for the child in those situations. And as mentioned before, find out who will be providing diabetes care for your child. Know how often the school nurse is in the building and how you can reach them. If you are lucky, they'll be in the building full time. Next slide. So how about the role of the student? Well, it's very important for the student to wear some sort of medical alert ID. Even though the school staff should be aware of the children in the school with diabetes, it's especially difficult in larger schools and especially high school. So it's good to have some sort of identification on the child. This child should also be comfortable going to their teacher whenever they feel high or low. And it's important that they carry some form of quick-acting glucose to treat a low. Often, their locker or health room may be a distance from their class, so it's always good to have in their backpack or in their pocket at least something that they can take if they're feeling low. And as the child gets older and more responsible for their own care, they should be part of any meeting about their care, because compliance is improved if the child is planning their own care. Next slide. Here in Colorado, we developed a collaborative group that includes parents, school nurses, school administrators, and providers with the goal of creating a standard of care for all children with chronic health conditions. The group focused on diabetes, and we put together this website for the use of parents, providers, and schools. And the website is coloradokidswithdiabetes.org. Now, all the forms that the school nurse would ever need are on this site. It includes health care plans and skills checklists. There's information for parents. There's information for providers. We have information about the Safe at School program and the Parent Advocate program. We've also pioneered a program called the Diabetes Resource Nurse Program. And these are nurses that are specially trained on diabetes care in the school, and they serve as a resource to school nurses. Very often they are school nurses, and they have developed a passion for working with children with diabetes, and so they are giving back by helping the school nurses in their area. So the site also includes their names and districts that they cover, so parents have access to that also. So this has been a tremendous help in improving the care of students with diabetes. We still have challenges, but I think we have made tremendous progress in this field. Next slide. One of the things we have here in Colorado, we're very fortunate to have a premier diabetes center for children. The Barbara Davis Center sees approximately 1,500 children with diabetes every year. They've been a wonderful resource for us. So as you can imagine, they get many phone calls daily from the schools. So we work with them to set up a model for communication. So initially, the school nurse, parent, and health aide need to work together to resolve any problems or questions. In addition, if additional help is needed, we encourage them to include the diabetes resource nurse in the discussion and problem solving. Of course, there are always questions that need to be answered by the provider, but hopefully we reduce the number of phone calls that they receive.
There's a solution that I created several years ago that helps a lot of these challenges that parents, school nurses, and clinicians face. When Sarah was 6 years old, she was diagnosed with diabetes. She's now 15. And a year after diagnosis, I realized that the school nurse and I needed a better way to communicate. So I created Blueloop for my own use. Other school nurses found out about it and were wanting to use it as well. So Blueloop is now something that's available to any and all caregivers of children with diabetes as well as any other chronic conditions. The way Blueloop works is it's the family that signs up for an account in order for it to be HIPAA compliant, and then the family grants access to various caregivers. It can be other family members, it can be the school nurse and school teachers, their clinic. Anyone who needs to be kept in the loop about how that child is doing could be added as a caregiver to the child's account. Then as daily activity happens, depending on the age and independence level of the child and where they're testing, whether it be in the classroom or in the nurse's office, that information can be put into the child's Blueloop account through the internet, through our mobile app, or with a smartphone. Then as soon as that information is entered, whether it be blood glucose, carbs, insulin, the nurse can simply write a note if she needs to, like, hey, we're running low on supplies. And as soon as that information is entered, it goes into the child's Blueloop account, it looks at the caregivers that mom has set up, and it instantly notifies those caregivers. So let's do an example of my daughter Sarah. Again, she's 15. She tests in the classroom, right there at her desk. She pulls out her test kit, tests herself, puts her test kit away, pulls out her iPhone, enters the information into her phone, puts her phone away, she's done. Instantly, the school nurse gets an email, I get a text message, and my husband gets a text message, but only if her blood sugars are out of a certain range. So without Sarah having to leave the classroom or be singled out or miss class time, we're all aware of how she's doing, and the school nurse will take follow-up steps if her blood sugar calls for that, like say if she's low, and the school nurse needs to follow up on that in 20 minutes. Otherwise, the school nurse is able to see those results and see that everything's going fine and not have to worry about how that student is doing. Blueloop has 3 interfaces. First, there's the family interface, there's a school nurse interface, and then there's a CDE or clinical interface. With the family interface, any caregivers are able to access and put information into the child's account, like that daily activity. Parents are able to document current dosages. They're able to upload documents like 504 plans or emergency plans or immunizations. Other caregivers are able to access those documents and see them as needed. Blueloop also offers a blood glucose log view where high and low blood sugars are highlighted, and so the parents and the student are able to see trends and catch them before they become a problem. With the school nurse interface, she is also able to put information into the child's account, but it's unique in that she's able to see multiple students on one login and password. So if a school nurse has 3 students across 2 campuses who she's caring for, she's able to remotely monitor those students and again take action as necessary or know that everything's going just fine. The school nurse is also able to access documents that have been uploaded. She's able to see that blood glucose log view. She can see current dosages, and she's able to communicate with the parents through the child's Blueloop account. And then there's the clinical interface. Doctors are able to see, again, that blood glucose log view. They're able to see current dosages. They're able to see results in a report format with graphs and trends. And then they have a patient tab where they are able to communicate directly with the family any changes that they see necessary with the child's dosages. The school nurse is also able to see these recommendations, and because Blueloop is HIPAA compliant, any communication made from the doctor to the school nurse can be considered doctor's orders. Blueloop can handle multiple conditions, not just diabetes, but really any condition that requires ongoing caregiver communication. So it can cover asthma, it can cover allergies, or even if it's a daily prescription that's taken at lunch every day, the school nurse is able to document that that's been done, and the parents can see that the medication is being taken. Here's an example now of the medical profile page. In this example, since Sarah is an insulin pump user, we're able to see all her dosage details, when the dosages were last updated, her basal rates, meal ratios, any other medications that she's taking. If this were a student with asthma or with allergies, this screen would look different, and it would be documenting things that are relevant to those conditions. So the benefits of Blueloop. For the school nurse, it provides better communication. It provides that remote monitoring if she's having to cover more than one campus. Teachers feel more comfortable with having students with diabetes in their classroom, knowing that the school nurse and the parents are aware of what's happening as it's happening and will intervene if necessary. And it gives them that easy access to documents and documentation. For doctors' offices, it offers more proactive care, as doctors are able to see those blood sugar logs real time and see the high and low blood sugars highlighted and intervene where necessary before that trend becomes a problem. So it's more proactive care that leads to healthier children. For the families, Blueloop's benefits are endless. Primarily, it gives peace of mind, which is the whole reason I created it, so that I would know throughout the day, whether Sarah was at school or at a friend's house, I would get my text message and know that she's doing okay, and be able to go on with my day, whether I'm at work or running errands. I have that peace of mind. It also offers independence for the child. As Sarah's getting older and she's learning to self-manage more, she can test herself, put those numbers into Blueloop, and I'm able to see that she's testing, and we don't have to talk about it so much. And for any age child, for them to be able to come home and mom and dad not greet them at the door with "How are your numbers today?" is just so freeing for the child, for diabetes to not have to be the topic of discussion so much. And instead, mom and dad can ask how the soccer game went, or whatever it happens to be. Most of all, with the use of Blueloop, kids can be kids. They can get that documentation done and move on and not have to be singled out, because kids with diabetes have all the opportunities that any other kids do, as long as they're given the right tools. We did a survey of our customers back in February. We surveyed 300 parents and school nurses, and I won't read you all these results, but you're able to see at a glance that a lot of parents use Blueloop for documentation. School nurses see that the benefit of Blueloop is that it makes their job easier and that they're able to provide better care. And then 9 out of 10 nurses and parents say that they would recommend Blueloop to someone else. So finally, how do you sign up for Blueloop? If you'll simply go to MyCareConnect.com, this is the home page you're looking at now. In the center, there's a button where families click in order to sign up. Again, it's the family that signs up for an account, and then they grant access to the various caregivers. There's a place for school nurses to click on a button and provide their information so that the family is able to grant her the access to the child's information. If you have any questions at all, we're always happy to help. Our phone number is on the website. And whether you're a school nurse or a parent or a clinician, we're always here to help, and we'll be glad to help you set up an account if that's what you'd like to do. And we're here to answer any questions you might have. Thank you.
Thank you, Pam and Crystal and Kathy. This is Sarah Butler, and I am a registered nurse, certified diabetes educator, and a nationally certified school nurse. I'm employed by the National Association of School Nurses, and I'm going to talk about the next couple summary slides, which a little bit might be new because we didn't have much audio in the beginning. But I did want to let you know that at NASN, the mission and what I work with is to improve the health of children, improve their academic success by providing school nurses with resources, research, educational programs, and advocacy. So the nation's children is our end focus. So at this point, we wanted to let you know that making your child's health concern known to the school is important, and it might be diabetes, but it also might be any others that your student might have, asthma, food allergies. And this meeting face-to-face is important. You know, it's important to ask some questions. You know, who is the school nurse? So when you meet them face-to-face, you might ask, are they the person who calls themselves a school nurse? Are they a medical assistant? Are they a secretary? Are they a registered nurse? Or are they an LPN? That's an important question to ask. And to know that when the school nurse is not available, who has been trained? With the IHP, Crystal already reviewed some of what that is. you have a real important role as a parent because you provide information that's really specific to your child, and that's what makes the care plan individualized. Like, what does your child say or do when they're experiencing a low blood sugar? That's a real individual detail that's going to be critical through the plan. How are their needs going to be met in the school environment? That's what the plan is going to help operationalize. So it takes the diabetes medical management plan, and we get to that point. Permission. You know, the educational system really relies on the school nurse to be the link between the medical and educational communities. So for the school nurse to be the advocate for your child's health needs at school and with the healthcare provider, we do need permission to speak with the healthcare provider. And that kind of completes that loop because we're all in that loop together. And I want to just, Crystal, again, explained about the 504 process, and we did have a lot of questions from school nurses about that, and I wanted to point them to a resource that for school nurses who need more information on the 504, there was an excellent Journal of School Nursing article on Section 504 and student health problems and the role of the nurse, and that was, it's available online as of May 31st, 2012. So that's something I would point the school nurse to do. On the next slide, this is a checklist that all parents of all students, so for going back to school, should be considered immunizations. And at this point, we're also looking at the flu vaccine. So if you're going to make an appointment and you're at your pediatrician's, ask about getting that flu vaccine and make sure you're up to date on the pertussis because of the whooping cough outbreaks. When you review hygiene tips about preventing the spread of infection, of course, that's the big one, is hand washing. At school, we really appreciate if you reinforce hand washing prior to blood sugar checks because at school they want to run in and get their finger stick, but if they've been touching something on their desk or in art class or in the cafeteria, that can really impact on the blood sugar, so we really reinforce them washing their hands before we check it at school. And the next two bullets really focus on developing routines and consistency, and we know that kids stay healthy and do better in school when they are on a good routine, family meals, wake-up time, bedtime, and diabetes also responds really well to routines. So that's a nice reminder there. Appropriate clothing choices, safe shoes. It could also include bike helmets, anything with these safeties that we need to kind of remind ourselves of. And then for a child with diabetes who might have an insulin pump, wearing a pair of spandex bike shorts possibly on gym day to secure the pump in there, and maybe that's a little helpful tip. The open line of communication arises here as well, but this time we're looking at also the psychosocial needs and talking about potential bullying, and so making sure that you know the school official to contact and follow up with. School nurses do monitor for signs of bullying, and they might see some injuries consistent with bullying, but the whole school team is involved in this. So if you bring the concern to a teacher, then again, make sure that you follow up with other school administrators if you're not satisfied with the response. So stay involved. And one question you can really ask your school when we're talking about wellness policies or parties and they're providing food, is my child's safety, health, and well-being the school's top priority? Because that really is one of the things that I think we're looking for our schools to be. Next slide. The next three slides are resources, and we get lots of questions about, what can I use to train and how do I do it, and we don't all need to reinvent the wheel. So the next three slides, we've selected some resources that really can be used together. The first one are the ADA training modules, and what's valuable about these is there's PowerPoint presentations broken down into each section of diabetes management, but there's also video clips that go along with that. And the video clips are very powerful, showing what hypoglycemia might look like for a teacher who may not have ever seen it, and watching people take the actions properly. Those can be downloaded from this website, or you can order a hard copy, and that can be mailed to you if you pay for the shipping. These trainings need to be designed just to fit the need, and we need to select the appropriate sections based on the school personnel's role. Helping the student with diabetes succeed, this guide for school personnel, I hope you've all seen it. It's another valuable resource put out by the developed by CDC and NIH, and Crystal and I both had the opportunity to help on the writing group. But the NDEP, National Diabetes Education Program, has some wonderful tools on this website, but this one particularly, you can download the whole manual or you can order a free copy. I suggest you order one and give it to your school nurse, order one and give it to your principal, have one for yourself, and it's a common guide that you can work from. Really good information. It's a consistent approach to training. It outlines 3 levels of training for all school staff or for the teacher, so it describes what an approach to take to the training of school staff. It also gives sheets of actions each should have, and it has some real good information, especially they've updated on insulin pumps in this one as well. This website also includes a transition checklist, so when your students in high school and moving on to look at graduating, that there's information that you can help provide to your healthcare provider when they're transitioning to adult care. And then the last publication is a publication that NASN has put out, and this kind of pulls everything together. This Managing Diabetes at School Toolkit is for school nurses or CDEs or anyone who's looking to set up a training program in their school, and it's based on 3 individualized healthcare plans that the school nurse can fill the blanks in to personalize it, but it really is detailed and walks through all aspects that we think are real important in overall planning, like how much assistance the student needs. There's skills checklists, procedures. Again, promotes the consistency in the planning and implementation of care. NASN also has a 2nd edition of the school nurse textbook, which just came out in June, and there's a whole chapter updated on diabetes. And ongoing education for school nurses is so critical to the whole process. So we hope that everyone takes advantage of these resources, and that's available for purchase on our NASN website as well. The next slide are a few of the websites that we'd like to point you to so you could get more information about MyCareConnect, again about the Diabetes Safe at School video clips and PowerPoints, but childrenwithdiabetes.com has really been the type 1 diabetes home base. Very comprehensive, wonderful opportunities for parents to interact with each other and kids, and then of course they have their live get-togethers where they have their conferences, and so that's just really neat. If you haven't heard about them, definitely check that out. We did have a lot of questions about insulin pumps, so there's a insulinpumper.org, and you can go there and you can see links to all the various devices, and then hopefully also the NASN.org, where we have a diabetes in children's page, and we have additional links as well as some online continuing education there. So next are the questions that Pam was going to moderate.
Okay, we were fortunate enough to have a lot of questions submitted to us, and obviously we don't have time to answer them all in 10 minutes, but I just wrote down a few of the ones that I thought we could go ahead and answer here on the phone. Hopefully some of them have also been answered throughout this webinar. And just be aware that if there are any questions that we're not able to get to, we will email you personally and answer your question for you and make sure that everything's answered for you. So the first one is someone who wrote in that they've recently moved to a small town with only one pediatric endocrinologist who, you all can read this, I don't need to read it to you, but apparently they're not a great doctor. And this doctor was, or the mom or dad was wondering what they should do about it. And Sarah, I think it was you that answered this question, is that right?
I did, because I think that the cornerstone of any relationship, any of the child's success, the family success with diabetes, is that positive, supportive, ongoing relationship, communication. And if it's just not there and you're seeing that staff has left and there's turnover, you really need to move on. And you may, if you've tried everything you can, then you may consult with your local ADA or JDRF chapter, and it could be that there's some other resources that you're not aware of. But I think that you do need to make sure you need the communication for really good care. So that's my suggestion.
Great. Okay, and then the next question talked about the role of the LSN in the school environment and where the school has in-house health aide managing the health office. I think either Sarah or Kathy, you would have addressed this question.
Yes, I think both of us kind of went in on answering this question, but the school nurse is really the cornerstone of assessing the student, and again with input from the provider and the family, and is really doing the coordination of the care. The health aide is working, under the direction and direct supervision of the licensed nurse. So it's very important to realize or to understand everyone's role.
Okay, and then the next question was about lockdowns and basically emergency plans and the use of glucagon.
That one is always very difficult because, again, you can't have glucagon in every classroom that the child is in. A lot of the suggestion would be to make sure that every classroom has a supply of snacks or juice in case of a low, and instructing the teachers what they need to do in those situations. But planning for emergencies is very important and should be done ahead of time so everyone knows what their role is and what supplies need to be with the child.
Okay, and the next one has to do with a child going into their first year of school and what they can do to help him not feel left out during class parties and events. As a mom, I'd like to, this is not my answer that you're seeing here, but I just want to interject and say that as a mom, my daughter has certainly seen discrimination in this area, and it's typically just a matter of education. There are very well-intentioned parents out there who think that they are doing my daughter a favor by bringing her sugar-free cupcakes or not allowing her to have a cupcake at all. And so just be aware they're not trying to single out your child or to be mean. It's simply a matter of educating them and educating the teacher as well. Okay, I'm sorry, go ahead.
No, this is Kathy again, and I was the one who answered that. And again, pre-planning, because a lot of times teachers are misinformed about that the child cannot have, share on the snacks. But sometimes, schools are trying to get away from a lot of the sweetened, drinks and cupcakes and donuts and just because of the wellness trend and obesity. And so hopefully educating, again, the teacher and the school to look at what kind of snacks are provided at class parties and events.
Right. And the next question is about a daughter with type 1 diabetes who simply doesn't want to talk about it, and the parents were wondering, should they respect her feelings to not talk about it or encourage her to talk and to tell them the problems that she has. Again, I'll interject this as a mom. I think it's best to let the child talk when they're willing to talk, and that is one of the nice things about MyCareConnect, is that as far as sharing blood glucose results and how the day went, because of the fact that both parents are getting their notifications throughout the day and they're aware of how their child is doing, when they come home from school at the end of the day, you're not greeting them at the door with, how are your numbers today? And it's simply becomes something you don't have to talk about so much. I know that as parents, we have to know how our children are doing, and so to a certain extent, we do have to talk about it, but I think that the child needs to own their own diabetes and discuss it on their terms. Crystal, you have a daughter, an older daughter. Do you have any thoughts on that?
Yeah, my daughter is 22, and she was diagnosed when she was 1.5 years old. So we kind of went through cycles where she didn't want to talk about it, and went through cycles where, of course, she was sometimes in denial that she had diabetes and was non-compliant. So, a couple thoughts. Talk to the guidance counselor at school. Talk to your healthcare, the child's healthcare professional. You might need, your child might need some professional help, but I agree with Pam. I think you follow your child's lead and just let them know that you're there for them, you're there to problem solve, you're there to help them. You're not there just, just to be a nudge, and let them lead the conversation and let them determine how much they want to talk to you about it.
Okay, and then Crystal, the next one's really for you too, because it has to do with legal rights. So it has to do with a school nurse telling a child that she wouldn't help him with his pump because she's not certified. And so how should the parents respond to that? I'm
not really sure what certified means, but it certainly is. The school certainly has a legal obligation to meet the needs of kids with diabetes. So my recommendation would be that the school nurse receive insulin pump training. I mean, I think diabetes in and of itself can be scary, and I think lack of knowledge and the fear of the unknown can sometimes be a barrier. So I'm really thinking in this case, the more training and education the school nurse has, maybe she's feeling some intimidation and some fear about programming the pump. So certainly educate, but also know that the school does have a legal obligation to meet the needs of the child and to meet the needs in a way so that that child can be can safely function and perform at school and be well supported. So I would write a provision also in the 504 plan that addresses who in addition to the child is going to be responsible for programming that pump. And to me, the natural person is the school nurse.
Crystal, this is Sarah, and I agree with everything you said. When I read the question, I was also thinking from a provider's point of view that maybe a school nurse told one of the kids of a practice that they wouldn't, help with the pump. So I also thought about just clarifying the expectations. Maybe the school nurse is thinking that they're being asked to do, say, a routine site change. And I agree, educate. I was thinking of online pump tutorials that are available on most of the websites of the pump companies. The hands workshop that NESN offers, the all-day workshop training, get up to speed on that. And the End Up School Guide has a section on pumps too. So I think between all of that, then I think that's the school nurse then will feel more empowered. And like you said, there is the legal obligation. Thank you.
Okay, we just have one more, and this is the most fascinating question to me. So, Crystal, I'd love for you to answer it for us. And then if you can answer it briefly, we'll then wrap up and let people know where they can get a recording of this webinar later. So what about the medical alert tattoo?
Yeah, my son has a medical alert tattoo on his underside of his forearm. He has to cover it at school. Is this legal? Well, if I were the parent, I would want to understand the reasons why he has to cover it. I mean, I suspect that maybe it's symbolic of some gang activity or relationship. I'm just speculating here. I would, find out the reason for the school's concerns and work with them to, to educate and help them to understand that the tattoo is there to help alert personnel that he has diabetes, make sure the school staff members who interface with him know about the tattoo, and write a provision in the child's Section 504 plan or IEP that addresses the concern and enables him to wear a short sleeve shirt so that he doesn't have to cover the tattoo. I have to say this is the first. I've not heard of this concern before. I mean, kids wear med alert bracelets and jewelry all the time, and I'm not really sure how this would be, any different from that jewelry that's so important, especially in the event of a diabetes emergency.
This is Kathleen. I just want to add that I think you're right, talking to the principal to find out what is the purpose of this particular policy. It may just be, every person with a tattoo needs to have it covered, and that just may be a straight across the board. But explaining to the principal and possibly making an exception it can always happen.
Okay, well, we are just a few minutes over our time, so we'll go ahead and wrap up. But thank you all for attending today, and want to let you know that a recording of the webinar will be available at mycareconnect.com/webinar. And we'll also have all your questions listed and the answers to those questions, because we did get some great questions, and unfortunately we can't address them all within this webinar. So thank you all very much, and good luck with your school years. Thank you.